Brain tumors can occur at any age. When we see a growth in the brain, it is called as a tumor. So all the tumors need not be malignant. And in the brain, a variety of tumors can occur. It depends upon the age, location, and the structure from which it is arising is going to decide the kind of symptoms and the manifestations of the problem. Tumors are common and the exact reason is still not very clear, though genetic, environmental, toxins and other causes have been implicated. No one exactly knows what induces a tumor in the body, and the same thing applies to the brain as well. For some unknown reasons, brain is another common site for the origin of tumors, particularly in children as well as in adults. And the tumors can arise from the bone, which is the skull covering the brain, also from the membranes that cover the brain, we call as the dura mater, and the blood vessels inside, the nerves, as well as the brain substance itself. So primarily, when someone talks about a brain tumor, they usually present with the headache. The headache is mostly progressive, most commonly troubled in the mornings, early morning particularly, associated with blurring of the vision and then the vomiting, which is instantaneous often. Most often, particularly in children, after the vomiting, the headache will come down in intensity, and the headache will not usually get relieved by the medicines, and it will be progressively increasing. And depending upon the location of the tumor in the brain, the associated neurological deficits will follow. So the commonest is if the brain is irritated or irritable in that area of the tumor, there will be epilepsy. It can be focal or generalized kind of epilepsies, followed by neurological deficits depending on the structure on which the tumor is producing pressure. If it is on the vision nerves, there will be decrease in the vision, or a weakness of the hand or the leg, difficulty in speaking, imbalance, etc. So whenever the headache is progressive and not responding to the treatment, associated with vomiting, usually in the morning, and has in combination with a neurological deficit, either in terms of epilepsy or a weakness of the hand, one should suspect a brain tumor. It doesn't mean all headaches are due to the brain tumor, but these are the symptoms one should be watchful.